You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. Of course, each week we bring you important and very useful information on issues facing baby boomers, their parents, and other loved ones. And as I do each week, and I'll continue to do, I want to thank all of you. I want to thank you because so many of you take individual podcasts or our entire Boomers Today show and share it with family and friends, and that's why our listeners are growing each and every day. So many of you listen on the whatever podcast station, Apple Podcasts, Google Podcasts, Spreaker, Stitcher, iHeartRadio, Spotify. We're on them all. So thank you so much for all your support. And it's quite clear to me why our listeners are growing every day, each and every day, is because we have wonderful guests on, and they're very educational, and I'm not going to disappoint you today, because we have with us today LaToria Woods, who's an experienced acute care adult gerontology clinical nurse specialist with a robust background in emergency nursing education and practice for the last 24 years. Currently serving as a nursing content specialist in the education division at the Emergency Nurses Association, she plays a pivotal role in developing educational resources for emergency nurses. LaToria also serves as a staff liaison for both the Emergency Nursing Advanced Practice Advisory Council and the Geriatric Committee Volunteer Groups at ENA. Her dedication to enhancing emergency nursing education underscores her passion for ensuring that geriatric patients receive the highest quality of care, ultimately leading to optimal health outcomes. So LaToria, thank you so much for joining us on Boomers Today. Really appreciate it.
Hello, Frank. Thank you for having me and that very excellent introduction.
Yeah.
I am happy to be here.
Yeah, well, you deserve that introduction. It's great. You got a wonderful background. So, with the aging population, as we all know, I got to believe that more and more people going into that emergency room are elderly. I don't know what the numbers are. You know better than I, but I just got to believe that many are elderly. So I guess, I like to just, start out by asking, how do we get hospital ERs? And maybe I should correct that, because I know you brought that up to me, that we don't even refer to them as ERs anymore. They're EDs, but I'll have you explain that. So how can we get hospital EDs to become more geriatric friendly?
Okay, so back in the day when MASH was around, I'm sure our audience knows what that show is. It was one of my favorite shows, but they used to refer to their health units as wards. So we did start out being an emergency ward, which was a compilation of maybe 4 or 5 beds in one room. So that's where emergency room originated. But then as our population started to grow, we had to make different areas within that room. So it turned into a department. And some of these departments are vast. Like one of the facilities that I work at, we have about 68 beds. So it is no longer a room, it's a full-blown department. But to answer your question as to how we can make our EDs more, did you say geriatric friendly, or more equipped to manage the geriatric population? Well, there are a variety of things that we do. First, the hospital administration has to be on board, right, with wanting to have resources available for geriatric patients, and also education for the healthcare providers that are managing these patients, like providing their care. One group that we partner with, they're called the American College of Emergency Physicians, and we call it ACEP for short. They have a geriatric emergency department accreditation program where you have to meet criteria in order to earn this accreditation to say to the public, hey, our emergency department is well equipped to manage the care of older adults that enter our doors. So it's a very robust program, very strategic in how you earn these accreditation levels. There are 3, by the way, level 1, 2, and 3. Level 1 is the beginning stage where you earn bronze, and you meet certain criteria, like you have to have the staffing, the education, policies and protocols in place, guidelines and procedures, quality improvement initiatives and outcome measures, also equipment and supplies, and you have to make sure the environment can physically handle older adult patients when they enter the doors. So after you earn bronze, which is the initial accreditation level, you can move on up to silver and gold.
So why wouldn't a particular emergency department at a hospital not be accredited? Is it what you were just explaining to me seems like, to me, a no-brainer? Is it money? I mean, why wouldn't they want to go do this?
So I don't think EDs do not want to earn this accreditation, but there is a lot involved. And if you don't have the staffing or the resources, or the department is even capable of managing a large influx of older adult patients, well, then you don't really meet the criteria to earn this accreditation. And there's also a fee associated with it. So when that comes to mind, I think of our critical access facilities that may not have the resources to earn this accreditation, but majority of our academic medical centers, at least in Illinois, I can speak to, we call it JEDA, Geriatric Emergency Department Accreditation, so accredited.
So the department gets accredited, all right. What about the individuals working there, the nurses, doctors, etc.? Is there some sort of accreditation or additional training that they have to go through as well?
So many of our emergency department physicians have specialized in geriatric care, specifically geriatric emergency medicine. The nurses attend courses to help enhance their education to learn about this population, and the Emergency Nurses Association provides geriatric emergency nursing education for that reason. You don't necessarily have to be accredited through ACEP to get this education, but it is a nice thing to have, so you can show the public that you truly care about older adults when they come through your doors. There are also 2 other organizations that provide education for physicians and nurses. One is called GEDC, that's GEDC, that's the Geriatric Emergency Department Collaborative. And another one is NICHE. I say niche, but I think some people pronounce it niche, NICHE. And they also provide education programs. They help hospitals become qualified to provide care for older adults. So it's specifically older adult care.
I'm from the Midwest like you, so I call it niche, but a lot of people do call it niche. Yeah. Okay. So the, maybe we could talk about some of maybe myths that you think need to be addressed regarding older adult care at an ED. I'm sure you get confronted with, hear about all sorts of issues or concerns or whatever, but maybe we could talk about some of those myths. So tell us a little more.
Oh, sure. So right off the top of my head, one myth that I think needs to be dispelled right away is that when older adults come to the ED, and they're not sick or they don't have any emergent need that needs care, that they come to visit us because they're lonely. That may be in part true, but I think that older adults love to have people around, sometimes because they don't have any friends or family that they can socialize with. So suffice it to say, I've been in situations where I've had older adults visit my department and they weren't ill. They just wanted somebody to show them love and care. And we don't mind doing that because 9 times out of 10, even though they don't come in with an issue, we tend to find problems. Like either it's a social problem where they need resources for food or housing or simple things like hearing aids or glasses. We can connect them with our social workers so they can help them in that aspect. So I think when they come in, the visit is not at all wasted. They get something out of it regardless, whether they want to speak with people, be around people so they're not afraid to be alone. A lot of them do live alone and they have a fear of falling, which is a big deal for this population. So if we can help them get over those fears, even just for a little bit, I'm all there for it.
Yeah. I mean, loneliness is a huge issue. Fall risk is also, and there are a lot of people living alone. So I was going to ask, but you kind of answered it, but just to repeat it, at the same time that you want to give them the attention, certainly you may have people that are there that need immediate assistance. So how do you manage that to talk with them quickly, but respectfully, and get them to a social worker or something? So how do they manage that when there's a lot going on in the emergency department?
Okay, so when any person comes through the emergency department doors, they are required to have a medical screening exam just to make sure that they're not having any conditions that may escalate to a situation that is dire. So they do come in, we do talk to them, we do find out if they have resources to manage their care. We do see if they have family members or friends who can help them get through trying times. And if they don't have those, we connect them with people in our facilities that can help them get everything that they need. So we talk to them as if they were entering as a patient, ruling out medical conditions that could be harmful to them, and making sure that their social determinants of health are met to the best of our ability.
Got it. So any other myths that come to mind?
Oh, sure. Okay, so I'm taking care of 2 older adult parents, and they have the biggest fear of going into hospitals, doctors' offices. They just do not want to go into these places because many of them think when you go in, that is it, that the next step is going to be a long-term care facility. And my mom has expressed that to me many times. She's like, oh, I have to go to the hospital. Are you going to put me in a nursing home? And I'm like, no. We're just trying to make sure you're okay. It's because she has a mild form of dementia. So I have to encourage her and remind her every time we go for a follow-up visit or blood work that she is definitely coming home. She is not going to a long-term care facility or what people know them as nursing homes. So that is one of the myths that they think that when they go into a hospital or an emergency department, that the next step is nursing home placement.
Yeah. So I'm going to throw out a question to you that I know you'll be able to handle. All right. But it's just something that I know I've dealt with, personally in my business and my work, not with family. But, you mentioned dementia, and that's what kind of set off a light in my head to ask you this. So as you know, and I'm sure it's not the case with your mom, but sometimes various forms of dementia, people start acting out and get angry and upset, and it's the disease, not necessarily the person. And the family doesn't know what to do. It's a very difficult situation. And, they might be, in fear, maybe physical fear or whatever. I mean, again, it's the disease, not the person. And they don't know anything else to do but to go to emergency. All right. So what happens in those situations where, it's due to dementia, now they're in the emergency department? I mean, my experience is, at least emergency departments I've dealt with, when I've had, families that have asked for, my assistance, they just want to get them out, get them in, get them out. They can't, there's nothing really they can do. And I'm sure we have people listening that may have encountered this or could be dealing with this in the future. Thoughts? What are your thoughts there? What recommendations do you have?
Okay, so
I know that's probably a long answer, but I'll let you give it a shot.
yeah, I'm gonna try to answer it in the most politically correct way I can.
Yeah.
When older adults experience dementia, like they're having issues with memory or cognitive decline, they do tend to forget where they are, right? The place doesn't seem familiar to them, and people call it acting out. I don't like to use that terminology. I like to use that they are in an unfamiliar place in their head. They don't feel safe, and this is the only way they can communicate that they need help to get back to a safe place. And unfortunately, some of these blow up into aggressive behavior, and they
Right.
do end up in the ED. When we get them, our first priority is figuring out if it's a medical reason that they're acting this way, or if it's in fact due to their cognitive decline, meaning dementia or Alzheimer's. And then we take the initiative to try to calm them down, reassure them that they're in a safe space. And plenty of times when you talk to them in that manner, and it takes time and you have to have patience, they tend to calm down, become more relaxed, and then we can move on to rule out medical conditions. The other thing we do is when they have to be admitted to the hospital, sometimes they don't like to stay in their room. They like to wander around, and we have things in place to keep them busy. Like fascinating stuff is on the rise. Like they have these things called memory carts where the older adult with dementia or Alzheimer's it's kind of like a game, put pieces together. Like back in my day, we didn't have these things. So I would have them fold sheets or
Right.
make beds, something
Right.
something
Sure.
to keep their mind occupied so they're not focused on what's happening inside their brain.
That's great.
Um, I'm sorry that you feel that the facilities seem like they're pushing them out. I don't think that's the case, and I could be biased, but
Well,
the
no,
EDs,
you might be right. I mean, again, it was just my experience on a couple of
right?
occasions. That's all. Yeah.
Yeah, it
Yeah.
may seem that way because we are in a very fast-paced environment where our goal is to stabilize them, treat them, get them where they need to be. And a lot of people don't understand why we do things that rapidly is because our doors never close. It's a revolving door and we have to get to everybody that comes through. But I feel bad that you experienced that, but I would like to say majority of the EDs don't operate that way, but we do have healthcare providers who experience burnout and stress, and sometimes it doesn't come out the right way.
Yeah, I would agree.
Um,
I would agree.
yeah.
Yeah. Great. Well, that's wonderful. Thank you for explaining that. Uh, LaToria, we're going to take a real quick break, I promise, just to recognize our sponsor. We come back, we'll, learn a little bit more about ENA and all the education that they provide. Okay.
Okay.
So do you know anyone who may be concerned about an older driver? Well, Senior Care Authority's Beyond Driving with Dignity program is a facilitated self-assessment program for older drivers. This program has been designed to serve as a vital tool to facilitate older drivers and their families as they make appropriate decisions regarding the future of one's safe driving career. If the individual is a safe driver, an advisor will provide him or her with strategies on how to remain a safe driver as they progress through the aging process. If driving retirement is the appropriate decision, then the individual and their family are offered possible alternatives, resources, and a specific plan to ensure a smooth and successful transition from the driver's seat to the passenger seat. So to learn more, go to www.beyonddrivingwithdignity.com or call 877-907-8841 to connect with a Senior Care Authority advisor in your area. And we're now back with LaToria Woods, who's really a specialist in emergency care, emergency department, and education, and part of the Emergency Nurses Association, the ENA. So, LaToria, maybe we could just start out. Feel free to share with our listeners, website or anything at all, or the work that you're doing that people could learn more about ENA or anything else that you'd like to share.
Yeah. So the Emergency Nurses Association has been around since 1970. It's a professional organization that represents emergency nursing professionals, and we are global. So we have partners worldwide to bring education to all of the healthcare providers, specifically nurses that work in the emergency care setting. We offer a wide variety of education for novice nurses who are new to the emergency department specialty, as well as those that are competent. And we're known for our GENE courses. That's our acronym for Geriatric Emergency Nursing Education. And the nurses have, and I found this out maybe like a month ago, they name themselves Genie nurses after they complete our education.
Right.
So we do offer education on dementia, the other conditions that plague older adults like cardiovascular disease, mental health. Falls is a big module we have in one of our courses. And then we recently had a course that's strictly focused on empathy and limited English proficient patients that present to the ED who are older adults. Dare I say it, but we're working on a course that is due to launch next year, specifically focused on the geriatric veteran. Now, they don't experience different care than older adults. It's the same disease states that are seen in civilian geriatric patients, but we dive a little more deep into the military life and the illnesses that they may be subjected to from combat. So that's coming out soon. And I did want to shoot a plug to our hospitals and organizations that utilize the Age-Friendly Health Systems Network. It's a initiative that was started by the John A. Hartford Foundation in collaboration with the Institute for Healthcare Improvement. And what their goal is to have evidence-based practice in facilities that offer geriatric care, regardless if it's in the emergency department, medical surgical unit, OR, what have you, that cause no harm and aligns with what matters to the older adult and their family caregivers. And on that note, they have this framework called the 4M's framework, and it has 4 components that help them provide the best care for older adults. What matters to the older adult that comes into their facility? We focus on medications, which some may be able to scale down the medications that they're on, because we know some of our older adults are on more than 15 medications. And then we also focus on mentation, like their cognitive ability, and mobility is a big one that we focus on to help them in their journey when they're visiting our facilities. So I just wanted to plug that out there. And we also utilize the 4M's framework in our geriatric education.
That's great. That's great. So, going back to the accreditation of the actual ED, if people wanted to find out if maybe the hospitals in their area are accredited in this way, can they find out? Is there an easy way to find out?
Oh, yes. I'm glad you asked. So if you visit the ACEP website, forgive me, I don't know the link offhand, but I think it's acep.org.
And that's spelled what? How do you spell that?
ACEP.
Okay. Great.
There is an actual map of all of their facilities that have earned the Geriatric Emergency Department accreditation.
Great. Great. And if we have, I'm sure we do, nurses that might be listening to this interview today with you, and they go, boy, I'd like to learn more about this, the ENA program, where would they go?
Okay, so they can visit our website. It's www.ena.org. Right. And for ACEP, their website is www.acep, that's acep.org. And they can find out more information about the Geriatric Emergency Department Accreditation Program. And when they visit the ENA webpage, they can find out everything we offer as far as education, advocacy, practice resources, clinical practice guidelines to help educate emergency nurses who are new to the specialty, and also who are competent, who want to go on to be in leadership roles or education roles.
Wonderful.
So we offer that as well.
Great. LaToria Woods, thanks for all you do, and thank you for joining us on Boomers Today. Really appreciate it.
Thank you for having me, Frank. This was so much fun.
Great. Well, thank you, everybody. Please be safe. Talk to you all next week.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.